The Fitch-Rona EMS Commission meeting is called to order at 7 p.m. Michelle, would you mind doing roll?
Certainly. Strassman,
Here.
Hilla, Roberts.
Roberts is here.
Okay. Cronin,
Present.
Johnson, Miller,
Here.
Lonsdorf, Schnapp,
Here.
Lugenbo,
He's excused.
Anderson,
Here,
Dostalek.
he will not be joining us tonight.
Okay.
Okay, thank you. We have 6 commission members present, so we have a quorum. We have no public comment, I'm told, so we'll go on to the presentation of the 2020 audit report from Johnson Block. And
Scott, are you able to make Brett the presenter?
I will give that a shot.
it's all yours, Brett.
It says I cannot share. Oh, maybe now I can. Oh, there we go. Oh, let's find the right spot. All righty. Can everybody see the financial statement overview? All right.
Yep.
Perfect. All right. So my name is Brett Hoffmeister. For those of you who haven't met me, I'm an audit manager with Johnson Block. We've been working with Fitch-Rona going back 7 or 8 years now. This is our we've done the audits and reviews over the past 7 or 8 years. So typically the commission does a review for 2 years and then an audit every 3rd year. So this year it says audit in the agenda, but we actually just did a review, which is less in scope than an audit, but it still provides some assurance that the financial statements are in accordance with GAAP. So we're still looking at full accrual GAAP financial statements here. We've still got all the necessary elements. I'm not going to go over those in detail. I put together this overview just to kind of pull out some highlights. I might hop over to the full report for one thing, but other than that, if you have any questions, feel free to interrupt me while I'm going through. And if you have any questions on anything in the overview or anything in the full reviewed financial statements, just let me know and I'll be happy to cover those. So first thing here is just kind of a brief summary of the content, what's in the review report. So we've got our independent review report. So that is just kind of gives our report on the financial statements. So in our, it's not really quite the same as an opinion, but in our conclusion, we just state that we don't see any material modifications of the financial statements, like any missing information, any adjustments that need to be made from what we've done for procedures. Everything is in accordance with GAAP from what we can see. And the main difference between an audit and a review is much more high level. It's primarily just inquiry and analytics. Or with an audit, we're actually doing substantiation of account balances. So we don't do quite so much of that in a review, but we still do provide some assurance. Financial statements, there's a couple different sets. There's your government-wide financial statements, which are full accrual, show all your long-term assets, long-term liabilities. And then there's your fund statements, which those are individual funds. So like your general fund and any special revenue funds. Those are kind of what I'm going to go over in this presentation. They have, that's kind of how you budget. More is on your fund basis, which is a modified accrual basis. So you don't have long-term assets, long-term liabilities on those financial statements. There's a set of notes to the financial statements, which unless there's any questions, I'm not really going to go over those in specifics because there's just a lot of information there. And then there's some required supplementary information, which just provides additional information for additional context. That's just required by GASB standards. looking at the actual numbers, this first page here is just kind of a summary of the financial position at the end of the year compares to 2019. At the end of 2020, up on the top here, we've got your assets first, just under $1 million. That's a decrease of about 130,000 from the year before. Cash and investments had the biggest change here, went from about 745,000 down to just over 600,000. Main driver there was just a decrease in fund balance for the year in your general fund, which I'll talk about that a little bit more in a second. Liability section, a little bit of a decrease here. You had accounts payable about $39,000, and then accrued liabilities of about 90,000. Accounts payable are just kind of your day-to-day payables and bills, and then the accrued liabilities are primarily payroll related. Biggest thing there that decreased, there's some sick leave, I think that had been accrued for some retirees, and a lot of that got paid out, if I'm remembering correctly. And I think some of the decrease there too might have been just timing of accrued payroll. The unavailable run revenue is deferred inflow of resources. This is just kind of a quirk of governmental accounting when we can recognize revenue. So it was about $102,000 at the end of 2020. That's up about 30,000 from the year before. The way governmental accounting standards work for your modified accrual, your fund financial statements, when you have receivables at the end of the year, if you don't collect those receivables within basically 2 months of year end, you can't show the revenue until you've made those collections. That's just kind of to make sure you're not showing like long-term receivables that are funding current activities. Is kind of the logic behind that. It's just to kind of keep things current, because in governments it's very year to year with tax levies funding most of your operations. So the unavailable run revenue, these are just runs that you've gone on and have the receivables out there in 2020, but you haven't made the collections yet, so we can't show the revenue. Basically all that is. And then we've got your fund balances at the end of the year, about $768,000 there, and a decrease of about 130,000 at the end of the year. I'll go into a little more detail on that in a second, but one thing we like to look at with this fund balance, it can be broken out into several different categories. Unassigned fund balance is one we typically focus on with governments, because that's what you have available to meet kind of your ongoing obligations. And when we get questions like, how are we doing, in general, like how's our financial health, one thing we look at is that unassigned fund balance number. At the end of the year, you had unassigned fund balances of about $373,000, decrease there again of about 130,000. When we look at that, one thing we look at is how much of that is, how much of your fund balance do you have of your next year's budget? At the end of the year, it was about 12% of your next year's budget. So your 2021 budget is about 3.2 million. So that unassigned fund balance is getting a little low. That is below your fund balance policy that is in the intergovernmental agreement. I think that calls for between 15 and 25% of undesignated or unassigned fund balance, in that unassigned balance. So this year you're at about 12%. So that's getting a little tight. Primary driver of that decrease over the last couple of years has just been revenues not quite hitting your budget expectations. Here we've got just a quick summary of your revenues and expenses comparing budget to actual. Both revenues and expenses were budgeted at about 3.2 million. For 2020, expenses came in right around budget expectations. You were actually a little bit under. So that was good that, payroll and everything kind of met what you were expecting. Revenues, on the other hand, came in quite a bit lower. Primary driver there is just your run fees. So the municipal assessments, those were all fine. There was some other miscellaneous stuff. You get some funding assistance program money, some other miscellaneous grants and donations. I think that stuff was kind of, for the most part, in line with expectations. Biggest thing, and actually this is, if I can file up, this will work. I just wanted to flip over to the detailed budget to actual that is included in the reviewed financial statements here, just to show this a little bit better. So looking up here, we've got town and village assessments. Those all came in right around budget. A little bit of a variance just due to some capital assessments. Other stuff, there were some extra grants and donations, but those things happen. The biggest thing here is your run fees budgeted at about 1.7 million. Actual came in at about 1.5. So you're under budget there by, a pretty healthy chunk, which that's what's driving that decrease in your fund balance for the year. So that's kind of something to keep in mind as you move forward here. I know we're already about halfway through 2021 or coming up on that. So it's something to keep an eye on. And one other thing, I'm going to kind of jump ahead of you in the presentation, but your budget number there is really a cash basis number. You're kind of budgeting for what your collections are going to be. When we look at the actual activity, we are actually grossing, we gross up the numbers on the financial statements and show it all kind of net of itself, or these two numbers net of each other, this run revenue and bad debts. So it kind of ends up being on about the same basis as what you budget for, but your total run revenue for the year was about 3.3 million when you look at your gross run fees. Then we have to take out your bad debts, which is going to be what Three Rivers isn't going to be able to collect, or you have adjustments for Medicaid, Medicare billings, insurance. Those are all negotiated rates, or Medicare and Medicaid, they're just going to pay you whatever their rate is. So that bad debt ends up being at about 1.9 million for 2020. Looking on here, we've got your bad debt as a percentage of revenue. That's been at about 55% the last couple of years. So that's been creeping up over the last 5 years. I don't know how much work you can do with the billing company to see if there's any improvement that can be made there. If they can turn around collections a little faster, that usually tends to help. But if that bad debt number were a little bit lower, that would give you some wiggle room there. And I guess, I don't know the ins and outs since we didn't do an audit this year, but if run projections aren't quite as meeting expectations, you might need to do some looking review there, see if you might just have to make it up through municipal assessments or some other funding source. And I'm sure that's not really anything new, but I just kind of wanted to go over that because that fund balance, it's about 12% here, so you're at around 2-ish months to 2-ish months there of unassigned fund balance, so that is getting a little tight. Typically we recommend there be around 3 or even upwards of 4 months in that unassigned fund balance number, so that is getting a little tight there. And the biggest thing there is you can just kind of start running into cash flow issues. You get a lot of your revenue through run fees, but a lot of the chunks too come through those municipal assessments. So the run fees really help you maintain cash flow throughout the year. And then those assessments come in big chunk payments throughout the year. So then you want something to help keep your cash flow a little smooth. Having that unassigned fund balance can help with that. All right, so other than that, some other information in here. This is just provide some detail of your fund balance. Some of that is tied up in non-spendable fund balance here, 113,000. That's inventories and prepaid. So non-spendable, that means you can't really use it to pay for other liabilities or like payroll. You do have some restricted money here, about $35,000. That's restricted for specific purposes. And then under this assigned fund balance category, there is fund balance set aside here for specific purposes. Biggest chunk is this employee benefits. And I believe this has been built up to try to help offset like future sick leave accruals that may need to be paid out when employees retire. The assigned fund balance here, I will note, this isn't restricted for anything. So it, if needed, it could be used for something else, but that does leave you with potential future liabilities that are uncovered when employees retire. If you have sick leave payouts or you have to pay for health insurance if they stay on your plan. So that's something to keep in mind there. The rest of the information, I'm just gonna kind of quickly go through. These are just kind of charts showing trends over the last few years. This shows revenues. See here, the municipal assessments are in blue, run fees are in red. Those are typically the two largest revenue sources for an EMS district, so no surprise there. The assessments can kind of vary depending on things like capital purchases, like 17 and 19 both had ambulance purchases. The charges for services had been increasing, kind of flattened out over the last couple of years there. And this just a little bit more detail about that. This other chart here just kind of shows expenditures. These are just your general EMS operating costs, and then this is capital outlay. Again, spikes in 17 and 19 are from ambulance purchases. And then EMS has gone up over the last couple of years just because of that, third frontline ambulance coming on. It was only partial year for 2019, and then 2020 is the first full year. That's all within budget expectations there. And other than that, I think that covers most of the stuff I wanted to talk about here. Are there any questions on anything I've gone over? All righty, well, I think that wraps up everything I want to talk about, unless somebody jumps in. I'm gonna stop sharing the screen here.
Okay, well, thank you,
Mhm.
Brett. If there's no questions, I guess we'll move on.
All righty, yeah, and if there are any questions, Patrick and Michelle both know how to get a hold of me, so if you have anything that comes up, just let them know, and I'll be happy to get back to you.
Okay, thank you.
All right, thank you.
Thank you, Brett.
Now let's move on to review and approval of the meeting minutes from April 15th. Were there any corrections that anyone saw? If not, I would support a motion to approve the minutes of April 15th.
I move to approve the minutes from April 15th, 2021.
Thank
I'll
you,
second the
Jim.
motion.
Thank you. All in favor of approving the minutes from April 15th, signify by saying aye.
Aye.
Aye. Anyone opposed? Hearing none, the minutes as submitted for April 15th, 2021 are approved. Next, we'll review the minutes from April 22nd, which I think was our special meeting.
Yeah.
Were there any corrections that anyone saw? Hearing none, support a motion to approve the minutes for April 22nd.
I'll move to approve the minutes from April 22nd, 2021.
And a second.
I'll second.
Thank you. All in favor of approving the minutes for April 22nd, signify by saying aye.
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 Anyone opposed? Hearing none, the minutes from April 22nd, 2021 are approved as submitted. Next, we'll move into the chief's report. Patrick?
Sure, thanks.
Take it
So
away.
thank you. This email, so this got emailed to you along with the audit. If you want to take a look at what Brett had talked about there, I'm going to address some of the stuff he talked about. Actually, I'll talk to you about some of the stuff we looked at based on what the report we got was. So you can see our April run volume was up again. I added a little line that we talked about last month. So taking out the calls at the Alliant Energy Center, because those are supposed to artificially raise our call volume. So in March, we actually did only have one call that we looked at last month. So it was 330 last month, and then was another really busy April. So 332 was an actual street 911 calls. So there was an additional 27 calls that came out of the Alliant Energy Center. So the number you see under 2021 is actually a real number. So again, it was a really busy month, and kind of seeing the exact same thing this month, not really related to COVID, just I don't know if it's nice weather, people are tired of being inside and getting out and about. I think it was just like even yesterday, I think they did 5 calls yesterday and they were up to 12 when I left this afternoon. So it's just been really busy. Otherwise, numbers are there. You see that Narcan calls are about where they're at. Car 17 has creeped up a little bit. Our response car runs by municipality are the same. Fractal times are where we want them to be. You saw it creeped up a little bit with about 10.454 calls per day. So adding a little bit more with their increase in call volume. As far as our training went, I didn't fill those in. By the time I had got this done, we actually did some more pediatric training. And then this month internally, we're actually doing some not heart stuff, it's high performance CPR. So trying to get back into where we were a little over a year ago and working and trying to do some, we kind of call it like a pit crew CPR type thing. It's getting people in the chest and knowing roles and working with our fire departments to improve CPR outcomes. I'll have Dr. Mancera, I'll work with him to get some time to do a nice report for us. So we've got the state of Wisconsin, it's part of the CARES registry. I think he actually brought that up about a year or 2 years ago. Essentially looks at cardiac survival rates. Dane County is a participant, so we can look at our numbers, Dane County's numbers, the states and the nationwide. So really just kind of some interesting stuff. Where Dane County as a whole, we're at about a 14% survival rate for those sudden cardiac arrests. Nationwide, it's still about 5. So it's actually looking pretty good. Top performers out there, which isn't always has been out in Washington State, they have about a 40% survival rate. Certain are out of hospital cardiac arrests. So trying to mimic a lot of stuff that is going on there. So that was the internal training we did this month. Really the only community events, the Verona High School has started last weekend. So Sunday and Monday started vaccinating their students. And so we went out to actually support that event for them. Calls by day of the week and day of the hour is pretty consistent to where we've been, as well as the calls by municipality. As usual, we had the sick person falls thing that just kind of keep flopping back and forth. Otherwise, those are our calls for service. Still seeing the most calls come out of station number 2. Aging report is where we expect it to be. Again, cash on hand, you can see where that is. That previous change from the month is primarily payroll. Savings account still has that $30,000 anti-idling grant we got from Epic. We should actually be taking delivery of the ambulance. Should be done about the first week of June. Would normally come down here. So we're going to June 25th is when they'll actually be dropping it off at our station. They asked if they could actually go show it off at a couple of trade shows because we've got the anti-idling technology in it, kind of the green promotion through our ambulance. So they're going to take it and show it off at a few places. Behooves us to get more entities on board with that as well. So should something go wrong with it, we've got more people in the area that would be able to repair it. But June 25th is when we'll see that ambulance, and then we'll see some money come out of these funds here to help pay for that. Our restricted funds haven't changed. We haven't tapped into that. And then again, made a whole $5.40 on our post-retirement healthcare that Brent was talking about with the phenomenal interest rates we're getting. No donations for this month, and then our main milestones. Sarah will hit 19 years this year, and then Chance, both Sarah and Chance, who have been with us full time. Chance was with us for a while longer as an explorer and an LTE, but both of them will hit 19 years, and Ryan Dockery will hit 14 years. Only other stuff I have to just chat with really quick is the what Brent had talked about is the receivable, the accounts receipt, the run income. So we got the audit, we got a draft copy of it about a month ago. It has been distributed to all the municipalities, so they have that now. But we took a look and saw, essentially he identified where that run income shortage was, and we've seen that. I'm gonna pull it up here. We've actually been looking at that for the last year as well. Every time we see that, you can see that there, that forecasted difference is what we saw all last year and all this year. So looking at that, trying to figure out, traced it back and said what happened or why is that occurring. Was actually able to trace it back. That was from the 2018 to the 2019 budget, exactly where you saw it in that the spike in the graph. He did it during kind of the estimation of what we were going to see with that third ambulance. The run income formula that determined our estimated run income was changed. It was me. So that was changed in there, trying to estimate that number. And that's what is now underestimating what that run income expectation is now for the last 2 years and will occur again this year as we're seeing here. So Michelle has done a lot of stuff, plugging the budget stuff in. We've gotten a couple set of eyes on this. I've got some ideas about what that's going to look like. It will be an increase in, on the plus side, as you showed, our expenditures are spot on, right? We actually underspent last year's budget by $55. So that's great. What we're missing is the expenditure for the run income. It's not as high as we are anticipating it to be. We can only raise rates so much. We will talk about this next month as well when we talk about the budget, because 2022 should be a rate raise year if you're interested, if we want to do that. Otherwise, that really the only way to make up that difference is municipal funds.
Is part of that because of Medicare, Medicaid?
No, we actually went back and no, we actually went back and looked. His chart kind of showed, and I'm working on putting the presentation together. I wasn't going to dig too deep into it this month because next month we're gonna spend the whole meeting talking about budget.
Okay.
So our overall run income has gone up. It hasn't gone up to what essentially the formula I went back and changed anticipated. So that difference is going to need to be made up from the municipalities. And as you saw, our reserve has creeped down there. I think even from 2019 to 20 to 21, it's been slowly creeping down, and it's because of that number. It's that run income. I did meet with Misty from Fitchburg last week. I met with Brian from the city of Verona Monday, and I met with Sarah out in the town of Verona yesterday. So I did give them kind of an overview of what this was going to look like, because there's going to be an increase from the municipalities to make up for that run revenue I screwed up that formula that we're not getting. So again, if you got any questions, you want to sit down and see what that's going to look like before next month, please let me know. I've got the whole presentation out there that I shared with the finance directors. Otherwise, I was going to just hit it next month and kind of show you what that looks like and what that means to get us back to where we should be, and then to tackle that problem of the reserve that is slowly going down and what plan it is to get us back up. Any questions on that part of it? We did, after talking with Misty, and then Michelle reached out to Three Rivers. As far as our bad debt and collections, Misty offered the city of Fitchburg at least uses the state. The state actually has a debt collection agency. So we've actually reached out, or Brad from Three Rivers is going to reach out to them. When we send things to Stark, as Brett had mentioned, after they go to the collection agency, we consider them uncollectible. Right? We've tried 30, 60, 90 days. He's contacted the hospital. The patients haven't responded. It goes to the collection agency. We're probably not going to get it because we usually don't get it. But the collection agency keeps 33% of what they bill out then, because they spend a lot more time digging in, trying to track these patients down. And then after a certain period of time, they actually keep 50% of it because they spend a lot of time trying to track these patients down. Again, we consider it uncollectible. So whatever they take. However, the state, providing we have good information, social security numbers, and like some other information, the state takes 3. So if we are able to get good information, we can start using the state collection agency. One of the challenges with that gets to be is even we're already enrolled in tax interception. So as long as we have data and somebody doesn't pay their bill, because we are a municipal entity per se, we can get in there. If they would have a refund coming from their state income tax, they don't get it. It actually gets routed. However, people with bigger entities get their money before we get them. So just kind of we get at the bottom of the list, but we do get more of it because they take a lower percent. So we have started working with kind of that bad debt project as well. Any other kind of questions on that? Otherwise, as far as our in-house budget, as you can see, we're already under for the 3rd year in a row, right? Overestimated what we'll be getting for run revenue. It's on track to be where we would normally be. It's just going to be under what we normally projected, or what we should get if that formula was correct. Otherwise, 32% through the year, and we're at about 30% of our expenditures for wages and benefits, so pretty spot on. Health insurance is always a little weird just because we're always a month ahead. We've actually had some pretty big, hopefully tune-up and repair will lower itself off. We've actually had some pretty big expenditures and some pretty big breaks on trucks. So hopefully that will level off and things will start being a little more not broken, I guess is the way to take that. Other stuff that stands out is the radio equipment. We've talked about this. This was trying to remember what that was. That was actually the additional purchase. There was grant funding for that. The CIP purchase for the new radios for the new ambulance, I think is still in there that we got to grab out. I think that's what that one was. Safety equipment. This was the PAPR hoods that we talked about earlier in the year. Otherwise, there's some of the things that get paid in chunks. So we prepay those. So those just like, we'll have that expenditure now. We won't have it again for another 3 months. But overall, 31.7% of expenditures, and we're 30%, 32% through the year. So back to, kind of had Brent said, we're spot on for expenditures where we normally are. Questions on this? All right, that's what I have for a chief's report.
Okay, thank you, Patrick. I'm assuming that there's no chair's report. I don't think personnel or finance met. So let's move on to review and approval of accounts payable checks. Are there any questions for Patrick?
I did have one JR brought. I think I talked about it last month about the phone bill. You'll see that $1,800 check to AT&T that actually went through this month and was paid. That is an abnormally high, crazy high phone bill. I think I remembered to explain it last month. So when we switched over to the FirstNet system through AT&T, so that is essentially an emergency responder. It is its own bandwidth in the cellular system that only emergency responders are on. So we switched all of our ambulances over, all of the phones in the ambulance and all of the cradle points, which is the wireless router in the ambulance, are all on FirstNet. AT&T offered a rebate. Essentially, for every new line activation, we got a $200 rebate, and then we purchased the cradle points for $200. That was why the radio line was over. That was for those antennas. So we paid for all the cradle points in the $1,800 check that we got this month. After it takes a couple billing cycles, when we'll start to see those $200 phone line credits. So the following months now should be a significantly less AT&T bill.
Okay, thank you. Support a motion to approve the accounts payable checks as submitted.
I move the accounts payable.
You had a second?
I'll second.
All in favor of approving the accounts payable checks as submitted, signify by saying aye.
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 Any opposed? Hearing none, the accounts payable checks as submitted are approved. Let's move on to review and possible action on the GASB 54 revisions.
So
Were there any changes in the numbers, Patrick?
So it was based on the numbers I got from the audit. So a lot of the numbers changed that, as Brent had talked about, that non-spendable for inventory and non-spendable for prepaids. So those numbers are updated based on what they got. Those numbers that they got, essentially, if you want to think about it, is right. Fitch-Rona has assets of $57,000, but that means I'm going to sell bandages on the side of the road to get money to make payroll. We can't really do that. So that's what the inventory is. And then the prepaid stuff is the stuff we pay for. It's considered paying for ahead of time. So we have like weird subscriptions to like our scheduling software that we pay now. We pay like in May of this year, then it's a year, so we'll go through May of next year. So essentially we can't prepay, we're prepaying 4 months of 2022 in 2021. So that's what that prepaid expenses are. You can't take that money back. So it's there, but it's spent. Otherwise, I updated the rest of the numbers that were on there. So some of those numbers did change, but they're what you see in those assigned or restricted funds.
Okay, thank you. So a motion to approve the GASB 54 revisions.
I'll move to approve.
And
I'll second.
All in favor of approving as submitted, signify by saying aye.
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 Any opposed? Hearing none, the Gatsby 54 revisions as submitted are approved. And Patrick, you wanted to talk about new bank account signatories?
Sure. So we previously had people, the ability to sign checks, as you're aware or may not know, for our new folks. I suppose we could have actually Dr. Lunsdorf, if you want to introduce yourself here or towards the end here to everybody. Any checks over $5,000 require 2 signatures, or if Patrick goes on vacation for a month, somebody else needs to go in and sign checks so that we can continue on to operations. Mike Durst was one of those signatories who is no longer on the commission. And I was going to reach out to you, Shannon. Did we ever get you connected with the bank?
No.
I said, I didn't think so. So as of right now, it is myself and Kate. So when Kate decides to go on vacation for a month, as do I, we need somebody to assign checks. Historically, it has been the sitting council or town board person from each one of the municipalities so that we have 3 people. But to do that, there needs to be something from this committee, essentially in the minutes that I send to the bank that said that the commission authorized the following people to sign checks. So what we need to do is I have already taken Mike off of that list. But if there's not any opposition, we should get Shannon put on there, and we should get David put on there from those 2 municipalities, so that there's a sitting person on each one of those boards that can come in and sign checks. I don't even know that we need a motion. I think there just needs to be a consensus.
Okay, David and Shannon, you're both okay with that?
Yeah, I'm good with that.
Okay,
Yeah, it's fine.
okay,
You can
thank you.
ask Kate. It's not really a ton of work. She lives like about 2 blocks away, so she's really awesome about coming in and just on beautiful days, she walks over and comes and signs
Nice
checks.
walk. Okay, so you don't think we need a motion then? It's just agreement?
Yep, just needs to make it in the minutes that this committee has appointed those 2 to be check signatories, and then I will connect Amber something, Michelle, Amber something from Oak Bank.
Yeah, from Oak Bank. It's the newer person that we have now.
Yeah,
Yeah,
I will.
Stephanie, it's Stephanie East, actually.
Okay,
That's who we'll work with.
okay. So Shannon
And
and
I
David,
just want to point out, this can all be done over email and text. You don't have to even go into the bank. So it'll be really easy to get hooked up.
so I'll share those emails with you either tomorrow or early next week. You'll hear from them, and it's just a bunch of signing some stuff.
Okay.
And that's what it's there for.
All right.
Usually we get about 3 or 4 checks that come in right around the commission meeting time, that we try to, if we start meeting face to face, most of the time they can be signed there. Otherwise, when we get the weird CIP purchases that are big purchases, so we just need someone to come sign them. So excellent. Thank you.
Okay. Yep, thank you. Let's move on to discussion about the joint municipal agreement. I guess ready to send it back, Patrick?
Yeah, so after the discussion last month, I didn't have a good clean document for you to look at, so that did get emailed out. This is the one that was made with all the final changes that we talked about at this group, and that came from the 3 municipalities. So just a good quick review of it, changed it from an older terminology of the EMS joint municipal agreement to an intergovernmental agreement between the 3 municipalities. We took the role of the treasurer out of there because it's an antiquated role that the commission doesn't sign checks anymore, except for the exception we just talked about. So we took that role of the treasurer out of the commission. We have policies in place that guide our current cash flow practices. There was some discussion that we had some of the roles of the secretary taken out, like minutes and posting notices and stuff. It was suggested by one of the municipalities that to leave those in there just so that the commission was ultimately responsible for that. But you can see as it gets delegated down, we do actually have that in job descriptions on our end. So I just left them in there. It's not a huge deal. Took the information about the treasurer out, added in the original IGA only addressed capital expenditures, so we put in their operational expenditures. That October date is fine. We took out that the commission doesn't recruit, train, and hire people. That's my job. We did add in there hiring and firing because at some point, if there was disciplinary action or me, the commission is responsible for terminating the chief. Or again, if there was disciplinary action that elevated itself above the role of the chief, it goes to the level of the commission. If we were ever to fire somebody on disciplinary action, that would actually be an action coming from this body. As far as the annual report, we messed with some of the language there, kind of acknowledged that the annual meeting is truly a symbolic opportunity for everybody to get together on controversial years or nobody to get together on non-controversial years. So we took those specific dates out of there and made it just sometime in October. And then we took out the shall adopt the budget to the annual meeting should be presented with the budget. But then really took out the ratification of it and put the language back in there that just says adoption of the budget is subject to regular budget review and approval of each municipality. So we'll still have the annual review. Everybody will still be invited. I will do the presentation of the walkthrough that you will see in June and July. We'll host that in October. Invite all the municipalities for you to get together and see each other or not. But then there will be no more caucus. There will be no more breaking into session and no more voting on stuff. It will truly, that process will be the process that it always goes through anyway, as the document originally had said. We changed capital expenditures to be in line with the city of Fitchburg, which is the most conservative of the three municipalities. Changed the language just to say assigned balance versus the undesignated and unreserved fund. We now call it assigned and unassigned balances. And then this is it takes out here's again, the charter that Brett had referred to of we should have a reserve fund between 15 and 25%. We are down to 12. I have figured out why, and we'll share that next month. And then the last section that we had talked about, that really there was nothing in there that said that this document should ever be reviewed, and the current document is 22 years old. So as opposed to putting in there a should or a shall, just said the document should be reviewed no less than 10 years. If it's not, so be it. It still stays into effect until the district is terminated. So if it doesn't get looked at for another 22 years, we're still in compliance with the intergovernmental agreement. Those were the only, and we changed the state statute that regards intergovernmental agreement. That was in the first line. So any questions? So if there's no questions, I guess we probably motion that the revised intergovernmental agreement goes back to the communities through their, whatever that process is. I'll work with the municipalities to find out how this works. Be it, I think it needs to be resolutions. So at least I talked with Misty about this process. She's the acting administrator for the city of Fitchburg, or one of the acting administrators. So she was going to help me fill out the template of introducing a resolution to the council, at least in Fitchburg, and I will work with Adam to find out how that works in Verona and Sarah in the town. So just need a motion to send this document out. I don't think, well, I do think, but I don't think the rest of the city councils will see this, because as of this moment in time, the mayors and the president and the city administrators have seen this. None of the rest of the councils have seen this. There may be a few more questions asked along the way. If you can answer those, or I guess I would ask, you're probably going to be the ones to introduce these to your councils. Let me know, or we'll coordinate when that is, and I can be there to answer questions.
Okay, I make a motion to move it through to review the changes.
Second,
I'll second.
all in favor of forwarding this, I guess, signify by saying aye.
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 And anybody opposed? Nope. So the motion to forward this as submitted by Patrick is approved. And then I see we have our monthly discussion about future virtual versus in-person. Is there a big demand for in-person meetings?
My only thought is June is when you get introduced to the budget, and sometimes that's a little easier to do in a room. But we will be June 2nd. I mean, I'm guessing everybody here is very following the public health laws, and after, or the public health guidance, and after June 2nd, essentially the world sort of kind of towards the next step to normalcy. But I'm not opposed to doing this or trying to do it in some hybrid module.
Yeah, can we have it in both venues, you think? Is that possible?
I think so. I mean, we stream it, or Fact TV streams it anyway. I think I think it's the ability to do some sort of hybrid version of this. And then I guess I would
not
read.
sure what Fitchburg's capabilities are, but the library board in Verona tried to hold hybrid meetings with some people on Zoom and some people in the room, and it was terrible. Nobody could hear. It was really hard to have any back and forth. So my preference would be either all in person or all virtual, but not a hybrid, unless Fitchburg has better technology to make that easier. I know Verona has been testing out a way to have hybrid meetings, but we haven't done it yet, so I can't speak to that, but that's just my experience.
So we've been able to do ours, but we've been able to do both, but it has to be in our council chambers in order for us to be able to do both. I don't think they have a place where, they can just set up and have you do a meeting in person and then do virtual as well. I think it's just in City Hall.
So,
I would just as soon do in-person meetings myself.
I'm
It
fine
doesn't
with
That's
matter. to
because
me.
I'm a little more technically challenged maybe than some others.
well, I'd be fine with an in-person. I think probably most of us have been vaccinated, so we're probably okay. Plus, we could do it's a big enough room, we could space out too, and that'd be a secondary kind of precaution.
Right.
Well, let's try the June meeting then in person.
Okay. And so
Anybody really opposed to that? Okay, let's go for it that way then.
okay.
Yeah.
I'm also going to change the location on you. So the AV system in Verona at the Verona Fire Station is defunct essentially, unless we want to hang a cord from the ceiling, and it I don't know, it's not working. So my suggestion would be Fitchburg Station number 3. So I wrote that address down here somewhere. It's off of Sain Road. I think it's 2931 South Sain Road. I think that 2950 South Sain Road. I will include that in the invite there.
Is that the newest one or the?
That's the new station, which I don't think we ever
Okay.
actually went to.
Yeah, we had a
we
meeting there
did.
once.
We did?
Yeah,
Yeah, we
Okay.
had one there, yeah.
Yep.
So
Okay,
that training room is a little bit bigger, so we actually will be able to space out a little bit more. But that's what I
Okay.
see. That's what I would suggest we have our next meeting at, until we can get the AV stuff fixed in Verona.
okay, sounds good.
Okay.
And any other business? I guess I had one comment. I've been chair for a couple of years now. If anybody is interested in being chair, I'd be very happy to pass the baton, so to speak. So think about it.
We can put that on the agenda for next month.
Sure.
Sure.
Because the only other comments I'd really quick, and it's really just a quick comment of expressing appreciation for those of you who dialed in early in the meeting. So live out in Cambridge, and I'm on a building committee here for a brand new EMS and fire station, and it has been a challenge. So expressing my appreciation to all of you and all of your municipalities for the support that you give police, fire, and EMS, because we have a phenomenal EMS district, and I know it rolls over to fire and police as well. And I know, not that it's not appreciated here, but man, you guys are easy to work with. So thank you.
Yeah, I noticed that, I think it was New Glarus was on TV, I think yesterday, where they're having a fundraiser to try to get new ambulances and everything. So they mustn't have a lot of community support either.
Yeah.
Interesting.
you know, the support is there, but it's, and I recognize everything costs money, but I just wanted to throw out a thank you very much to, from from me and our staff and you guys are there.
Well, thank you for what you do.
Municipalities are very supportive, so thank you.
So Michelle or Terry, I don't know if it matters, but it'll matter because I made motions. Did you capture that I joined the meeting?
I did.
Thank you.
Yep.
Did you caught Connie joined us as well?
I did.
Okay,
And Dave.
Yep, and I got
David.
David too.
Okay, well, if that's it, a motion to adjourn? Would
So
be
moved.
fine.
Seconded.
All in favor of adjourning, signify by saying aye.
Hi.
Aye.
Aye.
And I guess nobody's gonna oppose it, so see you all next month, June 17th at the fire station.
Sounds
Have a
good.
Good
All right.
evening.
Thank you, everybody.